Then the Democrats start parroting this talking point in interviews all weekend on CNN. They said, quote, "It's so harmful to the American people. You know, cutting Medicaid, cutting Medicare, threatening Social Security, cutting veteran benefits. It's all a lie."
Yeah, no, that was the lie, actually. And I think that more and more people know about that. They know that when Republican House Speaker Mike Johnson says they're not gonna cut Medicaid, it is a vicious, intentional lie. Even Republicans understand that, and they're pushing back against him, putting Mike Johnson in a pretty difficult position because he has to cut the better part of $1 trillion from Medicaid, while also convincing people that that's not what he's doing, and somehow not ruining the electoral prospects of many Republicans that are worried that this could end their careers. And they are worried about that. Just earlier this week, Republicans issued what's called a red line warning to Mike Johnson. They sent this letter. This is a dozen House Republicans that warned that they would not support a final reconciliation bill that includes, quote, "any reduction in Medicaid coverage for vulnerable populations. Balancing the federal budget must not come at the expense of those who depend on these benefits for their health and economic security." And that's what's gonna happen. Like they have all these cover stories, and I'm gonna give you some of them, but these Republicans know that that's what's gonna happen. Now, I'm a suspicious person, I'm a cynical person, and so we should also acknowledge the possibility that these Republicans are gonna end up supporting huge cuts, but they want to at least have put out a letter so they can say, well, I made the cuts not as bad or whatever, wink, wink, as they cut it. But Johnson, he's barely even giving them a cover story. So here's how he wants you to accept hundreds and hundreds and hundreds of billions of dollars of cuts to Medicaid. He says, we're gonna protect the benefits that everyone is legally entitled to. The beneficiaries who have a legal right to that, it will be preserved. Those are essential safety net programs that Republicans support. The president has made this clear. Social Security, Medicare, Medicaid will not take a hit. So you can count on that. Except that they will. He says, no, we're not gonna cut it. We're just gonna take people off who shouldn't be on it. And we're gonna have higher work requirements, which is gonna cut millions of people from the program just through added bureaucracy, if nothing else. We've already had the case study in many states. We know exactly what happens. That's why they're doing it. He says they can find billions in waste, fraud, and abuse in Medicaid. We can find well more than 800 billion in savings, and we will, which is the number we've been throwing around this entire time of what they're gonna cut. There is not $800 billion in Medicaid fraud. That's just not a thing. That's just cutting a significant chunk of all of Medicaid and then saying it's like welfare queens that were doing it or something. It's a cover story. Everybody can see through it. I hope that this thing falls apart, but Brett, I'm worried that it might not, that they might just ram it through no matter the cost.
Medicaid is the cheapest way to do this, period. On its face, ask a doctor. What money would you rather get? Would you rather get the reimbursement coming from Medicaid, Medicare, or private insurance? They're like, I want private insurance because they pay me the most. Then I want Medicare. Then I want Medicaid. I don't want us to have Medicaid for all. I want us to have Medicare for all because I, as a doctor, get paid at least more than I do on Medicaid or whatever you have for your state version of it that is essentially Medicaid. So that it is already the cheapest. Are there ways it can be improved? Obviously, there are ways it can be improved. But here's the thing. The Republican plan is to take the cheapest thing that essentially doesn't let anyone get away with all the fraud because there's just not enough money in it and get rid of it. And their solution is private health insurance, which if you're poor, screw it. There's all ways that like if you don't have any health insurance, like then you are actually the most expensive person because there's no money going into the system and it ends up costing us all more to like, thanks to Ronald Reagan saying that you have to take people in the emergency room, you would end up just funneling people into the most expensive, least reimbursed version of it possible because no one's getting any money. But they want to turn it all private. And the private version of health insurance is what we have and no one else has. And it's more expensive. It costs us more per person and we die sooner and all our drugs are more expensive for us. It sucks. They are pretending to save us money by cutting Medicaid. I saved you a bunch of money. But what are they doing? They're expanding the version of healthcare that is more expensive than anyone else's system in the world.
And worse, yeah, as you said.
And what's horrible is these guys are like, I'm the party of the poor now. I'm here for working class American. And what's the first thing they do? They take away benefits for poor people.
Yeah, but you have to be fair, Brett.
Explicitly.
And then what are they going to do with that money?
Keep it.
Oh, hand it to the rich. Actually.
Give it to rich people who own insurance companies. Like, dude, no one likes the insurance companies.
It's a beautiful scam.
It's a huge freaking scam, dude.
I agree.